For someone who is living with cancer, the support of their friends and family is crucial at this time. Hi everyone, my name is Corbett, and I'm going to be speaking to you about being a caregiver for a cancer patient. Some of you might have gone through this process before, with a friend, a family, or maybe even yourself. My husband was diagnosed with cancer in 2011. At the time, my youngest son was still in preschool and my oldest son just started kindergarten. This was the first time both of them were going to be at different schools. On top of this schedule change, we found out that their dad had cancer. The first process of finding out you have cancer is getting screened for it. You or your physician might have saw something that you want to run more tests on. It depends on what type of cancer they are looking for what type of test you will get. This might include getting an X-ray, a mammogram, a CAT scan, blood work, or even a biopsy. It can be harder to process negative results from the cancer prognosis. This would include the type of cancer, where it's located, and what stage it's at. The stage of cancer refers to the size of the tumor and if it has spread. Finding out the information will help you and your loved one figure out the best treatment options for them. You will also have to discuss if you are going to accept treatments. Most caregivers of a cancer patient are either close friends or family members. If a cancer patient doesn't have someone to take care of them, they can find help from the American Cancer Society, the hospital, or even hire a home nurse. And there are lots of options these days to help with the burdens of having an illness like this. As a caregiver, you have to realize that your life is going to change. According to a study at University of Minnesota Cancer Center, the objective of this study was to determine the different coping strategies associated with multiple terms of stress and negative health outcomes among caring family of caregivers. As a caregiver, you might experience stress from worrying, expecting the worst, and you might become nervous. It's important to figure out a coping strategy that best fits you and your lifestyle. A questionnaire that was done in the Ottawa Hospital read the difference between cancer patients and their caregivers. It was proven that caregivers show more signs of being anxious and depressed than the patients do. There was a lot of burdens. The most important one was being anxious and depressed. About 69% of caregivers that were employed reported that there was some impact of on their work, and 77 reported missing work because of caregiver responsibilities. It takes a lot out of you to care for somebody day in and day out. You will learn to be more flexible with your schedule and make the most of your time. This can be a positive experience if you like. The most important thing is being there for your loved one, and believe me, seeing them smile is all worth it. They would be expected to have a healthier lifestyle, and this would be eating healthier and exercising a little more. Take this opportunity to take walks with them every night and make healthier meals not only for them but also for you too. Here are a couple pictures that speak for themselves. This first picture is a picture of friends and family doing yoga together. The second picture is of somebody singing to a patient. And the third picture is a young child who gets a special visit from her dog. All of these images show how strong you can affect others from doing a good deed and letting them do something that they probably haven't been able to do in a while. It could be something small like going out for ice cream or playing a board game. I also found it nice to make a list of things you could do on those tough days that they might have. This will make it seem not so hard on them and also make them smile and make the day a little easier. Even if you're not a full-time caregiver to a cancer patient, you might still benefit from this information. If you have a friend, a family member who has been diagnosed with cancer, next time you see them, think of what you could do to make their day a little easier and put a smile on their face. It will feel good for you to do something special for them. And also remember to take care of yourself. Thanks for listening to my speech.